So here is a slide on pulmonary fibrosis. As I mentioned previously, it is common in 9/11 rescue workers who were exposed to toxins on that day. So it's exactly what it sounds like by its name. It's an increase in scar tissue formation in the alveoli. It is a restrictive lung disease. It does tend to happen in middle age, so middle age to older adults, but it can occur in any age. A couple years ago, I did a health fitness specialist workshop at a pulmonary rehab facility in the Washington, D.C. area, and they said, they get people in their 30s who develop pulmonary fibrosis. And so the causes, idiopathic, just like with hypertension, there's no known cause. So it's something that someone could get, and there's really no cause, there's no genetics, there's no pre-existing disease. So that is very scary. Certain autoimmune diseases can lead to pulmonary fibrosis. So if someone already has a disease like lupus or scleroderma, which is a hardening of the skin, they can be at increased risk. And so there is a genetic based as well. There can be some injuries, and it can be related to smoking as well. Though this is a CRPD versus a COPD. The symptoms are very similar to some of the other conditions we talked about. So this mismatch of dyspnea, so shortness of breath with mild exertion, a dry hacking cough, fatigue, and just a lot of overall chest discomfort. In looking at exercise training in people that have restrictive pulmonary disease, exercise training can be effective. So we would treat these folks very similar to what we would do with the COPD. So we want to improve their aerobic endurance and improve their muscular endurance. You can maybe get a tiny increase in their VO2 max. You can maybe get a better AVO2 extraction. You can help them reduce their fear of getting short of breath. And just like with COPD, improve muscular endurance, so resistance training for strength and endurance will help take the work off the lungs. They can do the inspiratory muscle training as well. That can help them. And just like people who have COPD, they're probably going to need some frequent breaks. And we'll review the case study if you look at page 142 in the chronic disease and disabilities text. So you might want to take a look at that before class. So really the main points for this class are know the differences between what diseases cause COPD versus it should be CRPD. Know the risk factors for each one of those, knowing that smoking is probably a major risk factor. Be able to understand the physiological changes between obstructive and restrictive diseases. And look at the exercise testing and programming, particularly the ACSM FITT for both of the conditions. And then here is our sample question. Is lung cancer COPD or is it a CRPD?